Just hello, namaste, and a warm welcome to the session on Let's Beat Cancer Together. I am Aziel Marquez, and I'm really happy to be the host for today's session. Before we proceed, it gives me great pleasure to introduce the key organizer of today's session, that is WICCI Equitable Parenting Council. So let me go ahead and just share my screen for a quick introduction about it. So yes, we are here. So WICCI stands for Women's Indian Chamber of Commerce and Industry, and it has been founded by Dr. Harbin Arora Rai. We in particular are the Women WICCI Equitable Parenting Council, with the key focus that we are aiming to bring gender parity between both the parents so that the child gets the love but of both the parents. Both the parents are equally responsible for the development of the child as well. And for that purpose, we conduct a lot of sessions, a lot of activities that will empower parents. Wiki in totality is a completely voluntary organization where experts from varied fields come together to support the society at large. So we are here, one such council that has done in the past 2 years of our kind of origin. We have done almost 90 sessions together on varied topics, right from health, mental health, legalities, finance, and all the aspects that we feel that really affect a family setup, that affect a parent, grandparents, and children. And this is done in order to ensure that our parents feel empowered and are happy, because only a happy, a healthy family can make a happy and healthy society, isn't it? And so, here to make this possible, we have a beautiful team of more than 20 council members across specialities, right from the medical fraternity, counseling and psychological fraternity, education field, of legal and financial, and many more. So, sharing a short video clip of the amazing team that I have, because of which we were able to do more than 90 beautiful, impactful sessions that have affected thousands and thousands family, not only in India but across the globe as well. So here's a gist of the council. So this has been a beautiful team, small, but a beautiful team that helps us to do sessions almost every week, at least one or two sessions, with the most amazing experts across the globe. Now, coming to our today's session on cancer. This, I think, has become a word that brings about a lot of fear, a lot of scare, uh, helplessness, uncertainty, and it has somewhere percolated in almost every family of ours, regardless socioeconomic status, regardless anything. There is no diversity, or there is no one who has escaped, and no one family that has escaped this particular term, right? But I think with today's session, which is focused on education, about awareness, we will move from being helpless to someone who's going to take conscious decisions on the journey. One, to prevent. Second, in case if we have got it, or any of a family member, how can we take a conscious, a mindful decision on what is a journey going to look forward. Okay, so we are going to be discussing about what is cancer, what are the different types of cancer, in particularly in adults. So this is in today's session is focused on adults. What are the different types of cancer? What are the signs and symptoms? How can one prevent it? And in case of one has, what are the remediation? What is the treatment line? And as a family, what can we do together to support the person who has got cancer, right? Because at this point, we require a good supportive system. And we have done sessions earlier on hospice care, on palliative care, to showcase how family can act as a very good support system for those who are really suffering through chronic ailments. And for this, we have our expert for today session comes in from a very renowned hospital from Mumbai, the Nanavati Max Super Speciality Hospital, and in particular the Institute of Cancer Care. With more than 75 years of existence in Mumbai, Nanavati has really changed lives of many, transformed lives. It has the Nanavati Max Institute of Cancer Care is a comprehensive tertiary care center of excellence known for its multidisciplinary, evidence-based, and precision-driven approach to cancer treatment. This institute offers a full spectrum of cancer care, including all types of cancer surgeries, minimally invasive and robotic procedures, personalized chemotherapy and systemic therapies, as well as uh, advanced radiation therapy supported by cutting-edge diagnostics and the state-of-the-art infrastructure. It is truly an honor to introduce our expert for today's session, Dr. Vaibhav Choudhary, Director, Medical and Precision Oncology at Nanavati Max Super Speciality Hospital. Dr. Vaibhav has completed his MBBS from Government Medical College, Nagpur, followed by an MD in General Medicine from the prestigious AIIMS, India Institute of Medical Sciences, New Delhi. He further specialized with a DM in Medical Oncology from Tata Memorial Hospital, Mumbai. Dr. Weber holds several international certifications and is an active member of multiple renowned professional organizations across the globe, reflecting his commitment to excellence, research, and patient centered care. Thank you so much, Dr. Weber, for taking the time to be with us and today and sharing your expertise with all of us. We are recording today's session because we wanted to go beyond the small group that we have. It's not small, it's really building, and more will be joining it. But we will be posting it on our YouTube channel so that thousands and lakhs of people across, not only in India, but across the globe, benefit from today's session and has the right knowledge and knowledge to know what has to be done and what has to be avoided. Now, giving the digital floor, handing over the digital floor to Dr. Weber. A warm welcome once again, Dr. Weber.
Yeah. Good afternoon, everyone, and really thank you for giving me this platform, obviously, to speak on this topic, which now everyone, as you also said, that scared of basically, because there are various misconception and a lot of things. new things, new research has also come up here in a long way, and that has actually changed the way that we doctors used to perceive cancer earlier. So I think I should be able to share my slides. Just let me know if my screens are visible. Yeah. So yeah. So coming to the point right now directly is what is cancer ultimately? Why are we scared of cancer? Ultimately, cancer is itself a disease, like any other disease. There are hundreds of diseases which are described, and there is remedy, there is treatment, everything is there. Why this C is called the big C, and why there are patients are actually scared. Even general public is scared. Even the patients who are suffering from cancer, they don't actually come out and share their journey with everyone. So there is a lot of stigma here which is associated, and that is because we are scared of what? We are scared of something which we don't know particularly and which we don't understand in a sense. If we know something very well, like we are not scared of our friends, right? We are not scared of anything which we know very well and very in depth, any subject which we are, for example, in examination, if we get a difficult question which we have never heard before, yes, we are scared. But if we get something which is we know very well, so ultimately, to remove the stigmata or the myths and all everything about cancer, we should actually try to know about it. We should try to understand what is cancer, what can be done to prevent it, A, and what can be done to manage it if eventually someone gets cancer,
Doctor,
and what we are dealing with once someone is diagnosed as cancer. So
Dr. Vaibhav, just
let's,
give me a moment.
yeah.
Someone has just shared their screen. Requesting Jambunanta Ji to just stop sharing your screen. I'm not sure how
I'm
it.
just trying. I'm just trying to do that. Somehow that is not happening. I will do one thing. I will just log out and then log in again. Thank
Yes,
you.
please, please.
Sorry for the inconvenience. I will log out and
No
then log
problem. Don't worry. Dr. Weber, maybe you'll have to restart your screen sharing. Yeah.
Yeah, I think it is still visible. My screen is visible.
No,
No.
between it was,
in. No, it was not visible, doctor. See,
yeah.
there was a problem. I tried to solve it, but
Okay.
the
Screen not
result is
blasting.
some other thing,
Okay.
like cancer.
Earlier it was visible. For some reason, the hosting right, the
Right
screen,
now, I think it is visible.
yeah, it just getting loaded. It we can't. Um, yes, right now it's visible. Yeah.
Right. So coming to the point is, what first of all, what is cancer? So cancer itself is not one disease. Like someone has diabetes, someone has hypertension, someone has malaria, someone has dengue, someone has COVID, right? So it is ultimately a disease. It is a chronic disease. Doesn't happen overnight, takes time, and takes time to treat as well as cure as well. So it is not one disease, first of all. That's why it is difficult to deal with, difficult to prevent, and difficult to treat. So it is more than a combination, a group of diseases basically of more than 200 different rare varieties of cancer, like different cancers, lung cancer, breast cancer, colorectal cancer, stomach cancer, gallbladder cancer, pancreatic cancer, and the list goes on. Around 200 types of cancers have been described in literature. So it is basically all of these diseases. What is common there is that is unusual cell growth, not only in the size, but also in the numbers. So these cells, which are actually supposed to divide to a particular extent and stop on its own, they actually are reprogrammed in such a way that that break is gone. So ultimately, it's that break, which mandatory statutory break after a certain division into a cell, which actually is gone because of a lot of things, maybe certain changes in the gene. It is called mutations. And this is as per the gene theory of cancer. Now, that is what is being more prevalent. There were multiple theories of cancer since thousands of years. First, a viral theory came, then gene theory currently is being worked on that yes, cancer in essence is a genetic disease until unless there is some problem, some changes in someone's genetics, and that can lead to that break fail, as I said earlier, and that can lead to the cancer. So another theory is coming on that I will come to later, that is immune theory of cancer. So ultimately, it's a group of diseases, unusual cell growth. Usually, everyone for us, for a newborn, also right from there to grow up to become a big person, we need cell division. And this cell division itself is a very, very well orchestrated kind of a thing. And this is how cancer starts when cell change. There are some changes and there is some abnormality. So as you can see, these pink ones are normal cells and the blue ones are cancer cells. And these are the cells, as you can see, the pink cells are normally aligned, they are regular in shape, they are all homogeneous. The cancer cells, for some reason, they actually have developed some unfair advantage of growth over the normal cells, and that has led to multiple division and relentless division of the cells, and also their size. As you can see, they are not very well aligned, they are irregular in shape, bigger and bigger nucleus. That is because of multiplication. Now coming to the cancer incidence in world and India, as someone pointed out earlier as well, that yes, cancer has now become more prevalent, not only in our country but also in the whole world as well. Now, there are millions of cases globally as well as in our country being diagnosed on an annual basis, and a lot of deaths are also happening. Uh, in our country because of cancer itself. Almost 8 lakh people die. More than 8 lakh people die per annum. This is an estimate some 5 years back, but I am sure, very sure, that today this number has increased, not decreased. These are earlier data from 2013 that we can see that in India, the top causes of cancer are stomach, liver, esophagus. In men, lung cancer, liver and stomach were commonest, whereas in in women, breast and cervix cancer were common. In India, when we talk about cancer, we cannot actually stay away from the oral cancer. And that is actually, as a combination, the biggest number, if you look at it, because India comprises a lot of rural population, and even in urban area also, there is this habit of tobacco chewing, and that particularly leads to this kind of a cancer. As you can see over this here in the photograph, this tongue lesion, this is an ulcer, and then it has now become a tumor proper. So, in India, in men, the commonest cancers is all those group. Sometimes it occurs in tongue, sometimes it occurs in the buccal mucosa, sometimes in the alveolus, sometimes it might come in the sinuses and larynx, voice box. So, right from wherever the tobacco exposure is there, it may lead to cancer because of chronic irritation. Also, lung cancer, as you can see over here, that also is quite common with tobacco exposure, especially smoking. For example, BD or cigarette smoking, that leads to the tobacco exposure to the lung, and that can actually cause lung cancer. So in India, for women, as you can see, breast cancer is the commonest. It has fast become the commonest cancer. Earlier in our training days, we all remember that cervix cancer was number one in our country amongst females, but breast has surpassed this number because of multiple factors, maybe urbanization and the westernization of the lifestyle, because in West, in US, breast was always the number one cancer, and that is what is being replicated in the urban world right now. In our Mumbai, Delhi, all these metropolitan Bangalore and all, more and more number of breast cancer cases are being found out, and the incidence and prevalence both are increasing. Whereas the cervix cancer, which used to be topmost cancer earlier in the rural population, that is diminishing because of we have excellent screening techniques. We have now implemented a vaccination program for HPV, human papilloma virus, and also a lot of this viral, because it is caused by a virus, so it is relatively simpler to control it. Whereas breast cancer, there is no direct correlation with any virus. Basically, it is with a lifestyle disease. So that's why its numbers are increasing. Again, the same trend, as I said, for men, it is lung, and for women, it is breast cancer. Now, coming to, as I said, there are 200 different types of cancer, but out of them, the most studied one are the commonest one, like lung, breast, colorectal, prostate, stomach. ovary, gallbladder. These are the commoner ones, and that's why they are very well studied. So we have these risk factors based on that. So as a general guidelines, we can actually do ourselves a good job, a favor by avoiding all these things, like tobacco. Tobacco is linked not only with oral cavity or tongue cancer or a lung cancer, it can also cause the food pipe cancer, windpipe cancer, stomach cancer, urinary bladder cancer, kidney cancer. So all these things, wherever those metabolites will go, can eventually lead to cancer. Certain chemicals like arsenic, asbestos, benzene, chromium, ionizing radiation definitely leads to cancer. So we should avoid exposure. Viruses and bacteria. Certain viruses, as I said, cervix cancer, HPV, human papilloma virus, liver cancer, HBV, hepatitis B virus, and hepatitis C virus. These are causative. Certain bacterial like cystosomiasis is a worm infestation, which again is related to cholangiocarcinoma. Hormones. Now, hormonal perturbation, hormonal changes can lead to certain cancers like breast cancer or prostate cancer or endometrium cancer for that matter. So hereditary wise, again, it is quite an overrated kind of a thing, but yes, these things do exist, that certain cancers actually run in families. They, if you take a proper family history of any patient, you'll find out that more than two, three blood relatives are being diagnosed with a similar kind of a cancer. Then you actually it raises the alarm, and then we test for the hereditary cancer syndromes. Typical hereditary cancer syndromes are hereditary breast and ovary. That's a combination. Certain family members will have breast cancer, certain family member will have ovary cancer, and certain might have both. So that is related, very well studied kind of a hereditary cancer, and because of the mutations in BRCA1 and BRCA2 genes. Certain familial cancers are like colorectal cancer and endometrial cancer combination. There is a syndrome again there. There is a familial aggregation of such cases. So there is a Lynch syndrome. So it's a different field, but as compared to other cancers, the hereditary part is only 5 to 10%. But it's very scary actually. And for those family members, obviously there are separate screening and guidelines as compared to the normal population. Lifestyle related, we all know alcohol, diet, and obesity. So now, how to combat cancer? We know it's a disease, and there must be a way to prevent it, because always prevention is better than cure. And how can we prevent it? We can prevent it by controlling the risk factor, which were there in the last slide. If we control them very effectively, almost negligible exposure is there for tobacco, alcohol, as well as viruses and the chemicals, then yes, we have a lesser and lesser chance of getting cancer. Also, the lifestyle disease. Ultimately, lifestyle means habits, customs, diet, addictions, environment. All these things actually we have to look at. And because it's a lifestyle disease, so pattern of cancer varies from country to country. Because the lifestyle patterns also vary from country to country. So, and also it is not static within a country. Coming to prevention and reducing the risk, avoid tobacco in all forms, avoid alcohol, maintain healthy diet and weight. Certain cancers are prone to in patients who have developed obesity. Be physically active, avoid obesity. Be sun safe. That is more relevant for Caucasian population. In our country, we do have a lot of melanin in our body, but still, sun exposure should be avoided. Unnecessary sun exposure should be avoided, because we do have certain cases of skin cancers also in our country as well, despite being very well protected. In the West, it is one of the commonest causes of cancer, basically. Also, get vaccinated wherever vaccines are available, as I pointed out earlier, for viruses like hepatitis B virus, human papilloma virus. There are universal vaccination programs. We should take advantage of that and prevent at least occurrence of these two cancers. Breastfeeding, it's very important. It has there, as I said, breast cancer is the commonest cancer in the world and very well studied one. So people have actually studied all the risk factor, what prevents, what decreases, what increases the incidence and all, and they have come to a conclusion that if a lady breastfeeds a child for more than 1 year, more than 12 months of breastfeeding for any one child, then her chances of getting breast cancer in future decrease drastically. So you can say that yes, breastfeeding not only nourishes the child as well, it is very good for the child, for child's immunity, child's overall nutrition, but it also has an indirect effect on the mother, and that is via decrease in the incidence of breast cancer. This has to be emphasized. No more. Now, your family and medical history, yes, for hereditary cancer, we should be aware that if certain individuals in the family have got cancer, especially at a younger age, then we should actually visit a genetic counselor and get ourselves tested for those genes. These are the simple things, as I said, low-hanging fruits. If you want to decrease the cancer burden in any country, you should target these. Tobacco, the sale of tobacco, the unregulated sale of tobacco, and especially to adolescents, which rampantly happens in our country, unfortunately. There has to be very, very strong legislation for that, because the earlier a person starts tobacco, chewing, or smoking, the more is the exposure, the longer is the exposure, and then eventually the chances of cancer increase in such patients. Unfortunately, I have seen cancers of oral cavity and lung cancer in as young as 20 to 25-year-old age. And it is very painful to actually treat those patients, because they actually, we treat them, we try to cure them, we succeed also a lot of time, but unnecessarily in those formative years, if you get such a roadblock, then actually it changes their whole life. So it is very unfortunate, and this can be actually tackled via legislation. Tobacco, as I said, not only oral cancer, not only lung cancer, voice box, throat, food pipe, stomach, pancreas, colon, cervix, even blood cancers. People have found out the relation of smoking and blood cancer. So one has to emphasize that there is no safe level or type of tobacco. Tobacco in all form kills, whatever it is. And this is how the incidence of the various cancers increased over the years, right from 1970 to 2009. This data set actually says that the mortality wise, we are able to decrease the mortality of cancers, but certain cancers like breast cancer have actually increased in incidence. Diet and cancer, this is the most common and the most relevant kind of a query that any oncologist gets, that is there any magic fruit? By eating that fruit, can we avoid cancer? Is there any fruit by which cancer gets cured? So ultimately, yes, we should have stick to a healthy diet. Eat fruits. Fruits are good. Vegetables, leafy vegetables, and they are all good for health. And not only cancer, but also other diseases, other chronic diseases. Like, it will help you in your lifestyle diseases and other chronic diseases as well. Whole grains, beans, lentils, where fibers are more and more, they reduce the risk of colorectal cancer directly. So we should actually include fruits and fiber in our diet always. Eat less processed meat, those canned food, and because they have a lot of preservatives which are directly carcinogenic. Sugary food and drink, they won't directly cause cancer, as has been promoted in a lot of YouTube videos that eat sugar and people get cancer, and stop sugar, the cancer cell dies. It's not that simple. If it would have been that simple, then people won't have spent billions of dollars in cancer research and found out the way how this carcinogenesis happens, and where to apply brakes and how to target the cells. We like to simplify things and project it in a way that we catch eyeballs, but unfortunately, this is very wrong message that sugar causes cancer. Not at all. Sugar doesn't cause cancer. Soft drinks have a huge quantity of sugar. They don't directly cause cancer. But are they healthy for you? They are not healthy for you. They actually impair your body defense. They cause obesity, especially childhood obesity as well. And they lead to a lot of other chronic diseases like diabetes, obesity. There is something called a syndrome X. Now, when someone has increased weight and they continue to gain weight from a very young age, those patients then develop cancers like a colorectal cancer or an endometrial cancer or a breast cancer. So there is an indirect link of excessive sugary food and drinks and the cancer. That's no direct link. And it is biggest myth that if someone gets cancer, starve the cancer cells by stopping sugar and all. It's not that. You are ultimately starving the patient and patient's immunity by, if we are tightly stopping everything, because sugars do contain calorie. A decent amount of calories should go inside the body per day, even if the patient has cancer or not, doesn't matter. Also, limit fatty food and salt. We should, as I said, that more salts, more to weight gain are directly or indirectly related to stomach cancer as well. This is how a healthy diet should actually include at least some of these stuff. Physical activity and cancer. Again, physical activity of any kind keeps the weight in healthy range, improves body immune system, lowers level of certain hormones such as estrogen. Excessive estrogen leads to breast cancer as well as endometrial cancers in female. And a good exercise routine or maintaining a good weight also improves the immunity. And immunity indirectly actually prevents us from a lot of cancers. Breastfeeding, I emphasized earlier as well that longer one breastfeeds, the greater benefit is for the patient herself and the kid as well. And it does decrease, as I said, 1 year, if at least 1 year, if a lady breastfeeds, then her chances of getting cancer, breast cancer at least in future, are markedly diminished. Vaccination, two viruses we have got a causative role and two very good vaccines, very effective vaccines. Now these are being promoted. Hepatitis B virus vaccine, there has been a universal vaccination program for that, and it has drastically cut down the cases of liver cancer in our country. Whereas HPV vaccine is being taken up very recently in past 5 years, and that also is now, we have already seen a dip in the cervix cancer because of the vaccination by HPV. Coming to early diagnosis, screening, yes, we should all be aware about the common cancer and healthy individuals. Screening is something called as healthy individuals getting certain tests and catching cancer early. Because as I said, prevention is better than cure, but catching a cancer early is equal to cure, and it increases your chances of cure. If you there are 4 stages of cancer: 1, 2, 3, and 4. So if we are able to catch the cancer in stage 1, where a lot of symptoms are not there, and then our chances of curing it increases drastically. So stage 1 and 2, usually what happens is a lot of these cancers don't present in that kind of a stage, by because in our country, like our cultural norms and all are like that, that's until unless someone has a lot of problem for a prolonged time, they won't turn to the doctor, and that's where cancer wins. And if we just are very much proactive of finding out what's wrong in our body and going to our doctor, we might have a very good chance against cancer, detecting it at an earlier stage and then curing it. So it is for the healthy population screening, and it is not for every cancer. As I said, there are 200 different types of cancer. How many are you going to screen? So we are going to screen only those which are a public health problem, like the commonest incidence, like breast cancer, which is easier to screen as well, and it is the commonest cancer in the world. Second, colon cancer, and also rectal cancer and prostate cancer. These four, there are universal guidelines for screening, and we should stick to them, and we should actually try to detect the cancer as early as possible. In India, we were the cervical cancer, cervix cancer capital of the world till a while back, but now we have actually made big strides in decreasing cervix cancer, and that is again through screening only. We have trained even Anganwadi workers in for screening of this thing, and there has been massive, massive government effort for screening cervix cancer in rural population, and that has translated into a lot of cure. So signs and symptoms, as I said, 200 different types of cancer. So 200 different signs and symptoms will be there, even more than that. So but there are certain signs which are common to all cancers. We can at least discuss that for the paucity of time. So oral cancer, red or white patch, especially, or growth or ulcer, or a loosening of teeth, especially in a guy who is chewing tobacco actively for past 2, 3, 4 years. If someone has that habit or someone is smoking, Then this white patch, rat patches are very common. It's rampant. If you visit a dentist anytime, he will tell you that most of his patients have these red and white patches. Out of those who are actively taking tobacco, they are at a higher risk. If someone is having ulcer or a growth, again, and a bleeding from any site. For neck, a lot of cancers actually drain in neck, and neck we have these lymph nodes. So swelling or lumps in neck, which are often painless. It might be indirect diagnosis of cancer from either site. Throat, if someone is having pain during swallowing, or there is a change in voice. These are the two commonest cause of throat cancer. Breast cancer, I think a lot of emphasis gone into awareness part of breast cancer, that is lump in breast or axilla, which is often painless, both of them. And bloody discharge from nipple or retracted nipple is also should not be ignored. All these symptoms are more relevant in a lady who is more than 45 years of age or more than 50 years of age. These are actually have to be evaluated in detail. For lung cancer, coughing, blood on coughing, persistent cough, chest pain, shortness of breath. These are the symptoms. Stomach, intestine, vomiting, small fullness after small meal, difficulty in swallowing, change in bowel habit, and black colored stools. So, as I said, it's impossible to pinpoint and all the cancers and all the symptoms. But yes, there are certain cancers which are the certain symptoms which should never be ignored because they might be because of cancer. These are blood in sputum, urine, or stool. Anywhere, if you are having significant bleeding from any site, you should come to your doctor for a thorough examination. Lumps, appearance of new lumps, sudden increase in size of old lump. This is very concerning. Black colored skin lesion, sudden increase in size. This is for melanoma that are bleeding from the skin lesion. Unexplained weight loss or loss of appetite, what should alarm someone, whether it is cancer or some other chronic disease like tuberculosis, and also jaundice. So, how a diagnosis of cancer is made when someone comes with the symptoms and signs, then a thorough physical examination and certain investigations, imaging and blood wise, and the most important part is biopsy. Staging, as I said, now more and more people are going for PET scan. That is a better form of doing a CT scan, where you are able to pinpoint all the cancerous involvement inside the body. And according to the staging, cancer has been staged in stage 1, 2, 3, and 4. Now, coming to the treatment. Once you have diagnosed by doing a biopsy, once you have staged the cancer by staging process, you come for the treatment part. The treatment encompasses of three things: surgery, radiation, and medical therapy. Medical therapy, again, has outgrown each and every other aspects of cancer control. We do have chemotherapy, target therapy, and immunotherapy right now. So I think there are a lot of frequently asked questions. Some I have pointed out. A lot of questions will be there with you as well, which I would like to address. So first of all, few questions from my side. That is cancer contagious? If someone gets cancer, I routinely get this query in my clinic as well, that patients are concerned that there are children in the house, there are husband, wife, they're sleeping on the same bed. Is this contagious? Now, it is a thing of past. I think all of us are educated enough. We know this, that it's not like tuberculosis. It doesn't spread from one person to another. It is not a communicable or contagious disease. It's a chronic lifestyle disease. So cancer is not contagious. Are more people getting cancer? Yes, definitely, because the lifestyle changes have happened and it's self-evident. Is cancer hereditary? As I said earlier, also only 5% to 10%. These are familial cancer syndromes, and we do have a stark family history in such cases. Can specific food cure cancer? Now, as I said, it's not so simple to cure cancer. There is no single food item which can cure it. Yes, But each and every cancer patient should have a healthy food habit, and these healthy food habits in general lowers the risk of cancer as well as its progression. Does microwave oven cause cancer? There is no evidence. Does cell phone cause cancer or wireless internet cause cancer? There is no evidence. A lot of research has gone into all that. Does eating sugar make cancer worse? Not at all. But it may actually increase the weight of the patient and may impair the treatment. Does biopsy or sugar surgery cause cancer to spread faster? Again, cancer cannot be diagnosed without a biopsy. So the problem is not with the biopsy. Problem is with waiting after the biopsy. We routinely biopsy the patient and then do surgery or do chemotherapy within a week of it. If you do a biopsy and wait for 2 months, obviously you are giving a chance to the cancer, and then cancer will definitely progress faster than it has progressed earlier. There is no rocket science behind it. So biopsy is or surgery, there ultimately it's a diagnostic tool. Doing biopsy is necessary, and biopsy is not cure. Biopsy doesn't guarantee cure. So you have to eventually give chemotherapy or eventually do surgery or radiation after the biopsy within a week's time. If you fail to do that, then only cancer will grow very fast. And then people blame that I have done biopsy and then cancer has grown faster. Earlier it was growing slower. So the thing is, do we want cancer to grow slow or fast, or do we want to get rid of cancer completely? If you want to get rid of cancer completely, you should actually do the biopsy and take action as soon as possible on that. Can herbal product cure cancer? Now it's a active area of research. Our government is heavily invested in that. So no comments on that. Once we get something good, we ourselves will share with you. Till the time there is no scientific evidence. Does antiperspirant, anti-deodorant cause cancer? No data to prove it yet. So that also is out. So thanks a lot. This was my bit about some fact FAQs and all, and certain general awareness points. Now the house is open. Whatever questions you have, I will be more than happy to answer them.
Thank you so much, Dr. Vaibhav. I think in a short period of time, you have covered a lot about cancer, right from the initial stage till the treatment, and even handling all the FAQs much in advance. There's a question put in the chat by Rohini. If cancer exists in the family, when should the screening start? What scans are mandatory for hereditary
So there
cancer?
are standard guidelines for that. For example, the commonest thing is breast cancer, breast and ovarian cancer. If you have certain individual with breast and ovarian cancer, first of all, you should test their genetics, the germline structure, whether this particular gene is present in that or not, or even that familiar clustering is because of chance. So if we find a germline variant of mutation of BRCA1 or BRCA2 in certain family member, then these are all specialized things. We have to basically make a family tree. Our genetic counselors speak to the patient, and those at risk, especially if someone has got cancer, then our daughters will be tested. Son will also be tested. Brothers and sisters will also be tested, right? And once any one of them comes positive, then those individuals, these guidelines apply only to those individuals. If without testing, there are no guidelines. Without testing, if you don't test the index person only for genetic mutation, you are just studying a pattern that might be because of chance, by because of environmental factors as well. Once you have a known cancer hereditary syndrome, then this is the way to go. And for that, for females as early as I said, for normal females, the mammography, the screening guidelines for breast cancer is mammography from the age of 40 to 45 years, yearly mammography. For BRCA mutated, if someone is, then it starts as early as 25 years. 25 years, and that also because young females used to have a dense breast, their mammography is not very sufficient to catch it. So MRI of breast is being done, bilateral breast, and a sonography of abdomen. These are there, starting from 25 years itself. For lung cancers, it's not very big problem. The hereditary part is not being there. For yes, colorectal cancer again, if someone has that Lynch syndrome where it is quite common to get colorectal cancer, then yes, scopies, one colonoscopy once every 2 years is being practiced right from the age of 40 years, as early as that.
That was quite comprehensive. Thank you. The next question that we have is by Shubhra. Kindly tell us about the use of immune therapy in cancer cure.
Yeah, so immune therapy has come up in a big way in past 15 years and in our country in past 10 years only. First 5 years, as happens with all good drugs and all, they were all concentrated in the Western world where a lot of clinical trials and all were being conducted, and they got approvals one after the another. So chemotherapy, immunotherapy has changed the face of stage 4 cancer from being a death sentence to something which is manageable and with a glimmer of hope for cure even also in stage 4 cancer. These are big words for a stage 4 cancer, but I am a precision oncologist. In my office, in my clinic, I routinely deal with stage 4 cancers only. So for those cancers, immunotherapy has proved to be a boon. The impact is not very big. It's like it's not the holy grail or of medical oncology that give immunotherapy to everyone and everyone's stage 4 cancer disappears. As I said, cancer is not that simple. But there are certain patients. So, for example, out of 100 of any cancer, that's a ballpark figure, 15 to 20% of those patients, even in stage 4 advanced diseases as well, they respond wonderfully to immunotherapy and they keep on responding. If they respond and the disease becomes zero, then eventually now we are in the state of de-escalating immunotherapy. Like someone's cancer, for example, lung cancer is controlled with immunotherapy without any evidence of disease. Then after 2 years, we are able to stop immunotherapy and observe the patient just on CT scans and PET scan. And eventually, these are the guidelines which are formed now that we can stop the therapy. And once 5, 6 years are there, then we can declare those patients as cured, right? So immunotherapy has worked very well. This is the result. How it actually works? It's actually, as I said, there is a gene theory of cancer which came up in 80s, and then we found out a lot of mutations and we developed drugs to target those mutations. So there what used to happen is that cancer cells used to become resistant after 6 months. So those gene therapies were target therapies were not curable. For immunotherapy, there is an immune theory of cancer. It states that these changes in the cell, they happen in every person's body. Everyone. No one is immune to these changes or mutations. But cancer is not happening to everyone. Cancer is still a relatively rare disease. It happens only in those persons where their cancer directed immunity is not up to the mark or their cancer is smart enough to evade their cancer directed immunity. There is something called as cancer directed innate immunity inside each and every one of us, which safeguards us from all sorts of cancers. Once it decreases, be it because of maybe classical case we have seen in HIV patients where their immunity goes for a toss, they are exposed for each and every kind of cancer many folds than normal population. In normal population, we have seen this evidence with kidney transplant patients, liver transplant patients. In future, they develop other cancers because of lack of immunity. And overall, certain patients where there are immunity is again a very complex topic. There are multiple aspects to it. If by some virtue something is being lost, so what immunotherapy does is it actually fulfills that gap and it directs your own immunity, your cancer directed immunity, that is particularly T cells, we call it. Right now, what we have is to inside these T cells to kill cancer cells. So immunotherapy doesn't directly go and kill the cancer cells. It's like the chemotherapy does that. Chemotherapy goes directly and kills the cancer cell, but immunotherapy actually goes and incites the immune cells, the T cells, to kill the cancer cell. So there is an indirect mechanism. That's why it takes a bit of a time to take effect. But when it takes effect, as I said, the effect is also not 100%, around 20-25% best case scenario, we get good results. But those patients are lucky. They outlive each and everyone, and their cancer actually, it's like being vaccinated against cancer if someone is responded beautifully to immunotherapy. So that's what immunotherapy is, and we have just scraped the tip of the iceberg right now for immunotherapy. There's It's a very big thing. There are tens of immunotherapies which are coming up in next 5 to 10 years, and completely it has the potential, if you ask me, to cure each and every of the stage 4 cancers. Right now, we do have solid answers for 15 to 20%. That number is fast rising with newer drugs coming in.
Right. Thank you. We have a question with respect to children. I think today's session was focused on adults, so we'll kind
Yeah.
of skip that question. The next question is about Miraya Nag. The question is, please throw some light on prevention of prostate cancer happening.
Yeah, right. It's like virtually impossible to prevent prostate cancer after a certain age. It was revealed in autopsies of a lot of elderly gentlemen. For some other reason, their autopsies being done after the age of 80, and most of them had prostate cancer. It was just not come to the light when they were alive. It did not cause any symptoms. So cancer, in essence, is an aging disease, and prostate cancer specifically occurs after 65, 70, 75, 80. It is rampant. And that is again because of senile changes, because of changes in the cell structures, and virtually it's impossible to prevent that after a particular age. But if someone is getting prostate cancer, someone is having a strong family history of in mother maybe breast cancer or ovarian cancer, in father prostate cancer at a young age. Young age means less than 60, less than 55, less than 40 also. I have seen very rarely cases of prostate cancer. There, this hereditary thing comes into the picture. There you should be aware that doctor himself should be alerted that such a young patient, he should thoroughly test them, take a proper family history. If they belong to that germline BRCA1, BRCA2, or some other cancer syndromes, then they have to be actually treated differently. And there are other drugs for that, target drugs, immune therapies, and all. They are all been there. And if someone has that gene inside the body and has not yet developed prostate cancer, then they should be actually screened very rigorously, starting from as early as 40 years of age. 40 years of age, once a year PSA and a sonography should be done, and should be followed up with a good urologist. Those are high risk cases, not for everyone. It's like not there is a big debate going on in the West where they had actually started this prostate screening program, doing PSAs for each and everyone after 60 years, after 45 years. A lot of things were there. But ultimately, what it just increases the burden of the disease. And a lot of those patients may not require treatment. Prostate is a slow growing disease. Very few prostate cancers are aggressive. So if some 80, 85-year-old, you are not doing a very good service to him by actually going in, digging in, and finding out his cancer for which he is asymptomatic. You might still try to offer some cure and all. There are still, mind you, there are still guidelines for such patients. If you find a very low grade of cancer inside a prostate, surveillance is one of the way to go. Just close follow up. Whenever he will have trouble, we will treat it. So prostate cancer is a different cancer. It's directly related to age, and screening. Yes, PSA. If you go to Chat GPT and all, you will find out that yes, there are guidelines for doing prostate specific antigen starting as early as 40 years yearly. But to ultimately, if you ask me, it's not very worthwhile, especially if someone is not at a high risk.
Okay. Thank you so much. Any questions? Anyone else who would like to ask any questions or any queries, doubts? Feel free. We have a minute or two to take another question. Doctor,
I
yes,
sorry.
Lekha. Yes, Lekha, go ahead.
Uh, Sometimes, we come across people when we have a conversation saying there were no symptoms, there was nothing, patient was perfectly all right, no fever, no stomach issues, nothing. But suddenly they've been diagnosed and it is stage 4, the last stages of cancer. How come that occurs? How is it that there isn't even the remotest little bit of something to say that something is not working correctly within us?
Yeah. So, Suman, actually, it depends basically what is the site of the cancer. A lot of times, for internal organs, the classical example is endometrial cancer. Endometrial cancer, if you look into its epidemiology, 80-90% of these endometrial cancer are diagnosed in stage 1 or 2. Why? Because it presents with bleeding in a postmenopausal lady. Now, it is such a rare symptom. such a rare symptom. And in early stage, it starts with a bleeding in postmenopausal lady. So any postmenopausal lady, if she has bleeding, she will definitely go to a doctor and get evaluated. So that's why endometrial cancer is being diagnosed. It's very rare to find endometrial cancer directly in stage 4. What you find routinely in stage 4, in my clinic, as I said, I am kind of a stage 4 specialist only. I only see stage 4 and relapse refractory difficult to treat cases. So there is pancreatic cancer,
Yes.
gallbladder cancer, cholangiocarcinoma, certain cancers arising from the lymph nodes in the abdomen. And
Yes.
there is one common thing about all these cancers. They are all visceral organ. They are internal organs, like lung cancer also. It's an internal organ. And sometimes they do cause some symptoms. It's not like that patient would always say that nothing is there and all and all. But ultimately, what symptom would it cause? It will cause dyspepsia. It will cause patients may confuse that symptom with heartburn. Patient may confuse that symptom with gas. Patient will confuse this symptom with something which is irrelevant. And that's how the world goes. Obviously, we don't keep on investigating each and every episode of constipation or dyspepsia. Problem is, we just keep on pushing it under the carpet again and again for months together. And then the cancer raises its ugly head straight away in stage 4. So it's virtually impossible to diagnose a stage 1 pancreatic cancer or stage 1 cholangio. You have to be very lucky. For some other reason, if some scan is done, for example, in COVID, lot of whole population underwent a CT scan. And there, the incidence of early stage lung cancer was highest during those COVID years. After that, again, we are struggling with stage 3, stage 4 cancers because they are not being picked up. So, not much can be done. Just awareness sessions like this and patients being aware of their own body and taking each and every symptom very seriously might help. Sometimes, yeah, it becomes inevitable. It becomes it's life ultimately, and you don't have answers for everything in life, whatever aspect. This is cancer, but in every aspect also, we don't have answers for everything. If you are faced directly with a stage 4 cancer, it means two things. One, you have been very tolerant if there have been some symptoms. Or two, the cancer is very aggressive. Its doubling time is very fast. And it has doubled in or tripled, or it actually the cell has to divide million of times before becoming a nodule and causing symptom. Then it's an emergent kind of thing to start treatment. Because with every passing day, the cancer cells will keep on increasing. So yes, and all these cancers, pancreatic, cholangio, all these are aggressive cancers. They are very fast dividing cancer. That's why that outlier is there. And people are working on it through genomics, testing the blood and all for asymptomatic cancer cells and all, and then directing it. But it's still an active area of research and difficult.
Thank you so much, doctor. Thank you, thank you,
Thank
thank
you.
you so much.
Thank you. Good evening, Doctor. Can I raise one question, Doctor?
Hello.
Good evening,
One more
Dr.
question.
Champunathan. Doctor, I mean, what is the best, see, today we are talking of prevention of cancer. So, I mean, can you suggest any, blood test or any other test that can generally warn a person about a positive possibility of cancer? And the second test is that second question, my question is that I think now there is a common feeling that cancer loves seniors. So, how to prevent that love? What are the special steps that seniors are supposed to take for preventing cancer? Please, thanks, Doctor.
So as I said, sir, the coming to the second question first, that is more important, more relevant. That yes, cancer is a disease of elderly. Why? Because in elderly, each and every organ starts failing. Liver starts failing, kidney starts failing. It is documented that your number of nephrons in your body will be much less than in a newborn or in an adult. So the body itself starts disintegrating, and when something keeps on ultimately disintegrating, then what happens is the chances of going wrong, chances of wrong division, chances of certain genetic changes increases exponentially. So that's why the commonest risk factor is age. Sometimes cancer breaks this rule in genetic and all, but then that is the norm. So ultimately, now we are wiser. We are finding out cancer, diagnosing it, trying to treat it, and prolonging life, which we are doing. But earlier also, when this thing was not there, and people used to die of cancer actually 80, 85, 90, 100 years, they used to get cancer. So it is directly related to aging. We can be aware, we can follow a healthy lifestyle, we can do some exercise, have a healthy food, as I said, as I covered in all my talk. All this for elderly only ultimately, because they are the highest risk of cancer. Nothing magical we can do. The only thing to prevent short way of avoiding all forms of cancer is not to be born only. Because if you are born, you are bound to have genes. Your cells will divide, and there is a chance. It's just a probability. It's a mathematical probability that something will go wrong, and sometimes your immunity may not cover it, and it becomes cancer. So there is no sure shot formula for that. Second, yes, your question was very scientific. Basically, if you when you asked about the blood test, yes, we are very close to getting a blood test approved by FDA, where they are actually checking the cancer DNA in the blood, and it is called ctDNA. And by virtue of that, they are predicting that certain person, a normal looking person, might be harboring some cancer specific to certain body part. Example is colorectal cancer, which is rampant in Western world, and they have developed a test. Basically, it's called Shield, and it has got an approval as well. In India, they have started marketing it, but that is specific for one cancer, colon cancer. Not, as I said, there are more than 200 types of cancer. So we can't keep on doing 200 different tests for different types of cancer and developing them. For common cancers, yes, I think they will come eventually one by one, like colon thing has come in. The rest of the things will eventually come in.
Thank you, doctor. Thank you.
Thank you.
Doctor, can we take one final question? I think Walter has raised. Yeah, thank you so much. Yes, Walter, can you
Doc-
take the question?
Doctor, in a news there was written that China with AI they have done a lot of research on that and they have prevented cancer and all the treatment. So is that is possible?
Maybe if they are doing it, then it is good for the mankind. Ultimately, it should happen. If that is there, I'm no one to pass judgment on AI, and AI is ultimately artificial intelligence. What it does is whatever the existing knowledge, existing research is there scattered around all the world, it compiles it in a matter of seconds and brings it in front of you. Ultimately, it never helps me in treating a cancer patient who is suffering with pain, who is sitting in front of me and wincing in pain. What helps me there is OCI, that is original compassionate intelligence, not artificial intelligence. So
Sir,
ultimately, yes, AI can do that to all those things and all. If we are able to prevent cancer, nothing like it, we will be very happy. But right now, it can ultimately, we also use AI, a lot of AI, because we want the data just like this in a click of a second. And then beyond that, it's your experience, and AI cannot teach me how to talk to the patient, how to personalize my therapy. So those things are being filled up, and AI is getting better. If we reach that point, nothing like it. If we can prevent all cancers, this is and again, as I said, again, they are also doing a lot of research there. Every country is doing. In India also,
sir,
we are doing. You'll be surprised to know.
sir, I have a small question, sir. Can I?
Mhm.
Say, when I was in post graduation, my teacher used to say, cancer. There are two types of cancer. One is benign, another is malignant. That cancer definition used to say a cell which has undergone mad. So I'm not a medicine student, sir, but a cell, what makes the cell to undergo irregular multiplication? He used to say it's undergone mad. Then it will lead to a malignant cancer.
Yeah, rather
Will you
than
please?
going mad, actually, it has become smarter. What
Yeah.
happens is ultimately it's cancer is a live cell,
Yeah.
and what every live thing has, what is basically Darwinian's hypothesis, and what every live thing wants is life. If
Mm.
you try to kill it, it will evade it. It will develop resistance. It will adopt. It's like that. Cancer cell is no different. It's a live cell. It is our own body cell. That's why it is all the more difficult to deal with it. So these are smarter cells basically, which outgrow the cells. And as I said, gene theory, genetic defect, and immune theory, that our immunity somewhere actually becomes redundant and lets the cancer spread. So these two things are there, which we are working on right now.
Okay, sir. Thank you.
Thank you.
Thank you, Dr. Vaibhav. I think we have come to the end of today's session, but I think most importantly, we are moving from feeling helpless to such a scenario to something hopeful that yes, there are possibilities, there are prevention, and yes, there's cure. And I think we are getting better and better in the cure aspect as well, and identifying. So thank you so much, Dr. Weber, for your help, for your expertise, for sharing. I think within just 30 minutes, you took the end. I wouldn't say, but you spoke so much about cancer. I was unaware of quite a few things. I'm sure for many it would have been new knowledge or knowledge coming in from the right source. I think that is also equally important because the WhatsApp University and the University is kind of buzzing with all of these terms that it makes us uh, kind of question our own identity and question our own existence per se. And we are not sure quite often what is right and what is wrong. But sessions like this, and especially today's session where you threw in so much light in such simplicity, I think I'm quite grateful to you for spending your time this Sunday with us. And thank you so much.
Okay, thank you.
The hospital, the Nanavati Max Super Speciality, and Kaushal, who has coordinated for this entire session. Thank you for all your support, and thank you so much all the participants for joining in. I think today's session will make us feel uh, aware and also help us support those who are going through those stress to find the right solution or the best solution possible from the right experts. We will be sharing the video of today's session so that we can go through the session once again in our own spare time. Plus, we could share it with those who are in need because we are not sure how one particular session like this today's session could support someone's painful journey and or prevent them from getting into painful scenarios, right? So thank you so much everyone for joining in. Thank you all the council members for joining in, and very soon we will be coming in with much more or many more such sessions with respect to health, with respect to mental health and the likes. So stay tuned and continue to be in our WhatsApp group. As you all know that we have been conducting such sessions and we will continue conducting many such sessions in the future as well. So stay tuned to it and also invite all your family members, your colleagues, your friends, relatives, so that they are aware of what's happening in the world. And I think we are there as a space where we are trying to promote the right information rather than buzzing information or trending information. We are trying to get the best of experts as we got today and as we have got previously, who could throw light on serious issues that impact our life, impact our families, impact our health, right? So please do invite your family, friends, your colleagues, and neighbors, everyone into the WhatsApp group. So for now, have a blessed week ahead, have a blessed time, have a good family time, and a good self healthy moment as well. So, with this, we end today's session and thank you and
Thank
God
you.
bless. Take care of
Thank you.
yourself.
Thank you.
Thank you,
Thank
Dr.
you.
Vaibhav, once
Thank you,
again.
doctor. Thank you,
Thank
doctor.
you. Thank you. Thank you.
It was a wonderful session. Thank you.
Thank you.